Hi doctors, this is a spacing case with some degree of difficulty. So this has upper spaces and lower crowding. So these are arches that don't fit together very well, and the patient wants all of these anterior spaces closed. So one good thing that we have for predictability is we do have the correct retention attachments, and we have bite ramps on the anterior and some lower IPR. This overjet at finish that we see on the left hand side is really tight. When you need to do lower IPR and intrude, it is very likely that these teeth may lag behind, and if they lag behind in the intrusion in any way, then these are going to finish with a posterior open bite. So one of the good things that I did is redistribute the space distal to the canines. So adding more space distal to the canines allows the patient to have a very aesthetic smile without having to risk a posterior open bite. Even with that space distal to the canines, the lower IPR is still needed so that we can finish with an adequate overjet to prevent posterior open bite. Looking again at the attachments that we have planned, so some of the premolars are rotating, some should, some shouldn't. So when we look at the upper arch, these premolars, so we'll take a look at number 4 for example, is occupying more space mesiodistal in its position starting than if the rotation gets quote unquote corrected. When this gets corrected, it occupies less space in the arch, which very subtly but does increase how much space has to be left distal to the canines. So one thing that I would have liked to have done is eliminate the correction of rotation on the upper arch, and so then these retention attachments would be appropriate. Looking towards the lower arch, I don't often rotate lower premolars, but these premolars actually do seem to take up more space in their starting position than if we were to rotate them. So there's a rotation attachment on 29. 20 is also rotating, but it doesn't have the rotation attachment. So it's possible that this tooth still may rotate, even because it has some attachment on it, even though that's not the best attachment designed for that type of movement. But we'll see how this goes along. With only 10 aligners, the patient should be able to go through this treatment pretty quickly. So if any additional aligners are needed, then it can be focused on just whichever movements didn't happen as well, in which you'd be surprised. Sometimes those things can work out. But then this patient, the other thing I would add would be an anterior C-chain to help ensure that those spaces are completely closed, as sometimes space closure can lag behind as well. So those are just some things that may need to be added in a refinement, but with good retention on the arch, which we have, then a lot of other movements can be executed very nicely.